What's going on, everyone? Happy Sunday to everyone. Hopefully everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Sunday edition of the Pandemic Update for Sunday, July 21st, 2024. If you're new to my channel, welcome to my channel. This is where we do the daily pandemic update on all things COVID and any other virus that could be a health threat to you. Let's face it, there are a lot of different viruses out there, and you need to know what's going on with each and every one of these viruses. That's what we do here. We do daily updates every day, and on certain days we do different things. Today being Sunday, we'll share just a couple news stories. Then we will make our main focus be on COVID in wastewater. We can detect other viruses in wastewater as well. Oftentimes I get asked, how does wastewater work? Well, each household, business, different places have restrooms, correct? Well, that wastewater is then sent on to wastewater treatment facilities. They can take samples at those facilities to detect the different levels of viruses in a community, such as COVID, flu, RSV, HMPV, norovirus, H5N1, that is slowly starting to become a thing in wastewater, Mpox, whole bunch of different viruses can be detected. And then once they take the samples are brought back, and we see what the levels are. And it's something that has been very useful for COVID, as not as many people are being tested for COVID this day and age. So if you're new to my channel, subscribe down below, hit that notification bell, give this a thumbs up, share these videos with anyone you know, and of course leave your comments down below. Starting off today in India, and this is something that should not be too much of a surprise. In fact, I was expecting this would have come out maybe a little bit sooner, but here we are. India's official death toll in 2020 during pandemic underestimated by 8 times. Now, let me clarify something here. It says during pandemic in 2020. 2020 was definitely the pandemic, as was 2021, 2022, 2023, and though not everyone will agree, yes, 2024, we still call it a pandemic. We still call these updates the daily pandemic update. Will we ever change the name of that? I don't know. Maybe we will someday. But right now, what you need to know is India's death toll, they're one of the most populated countries in the world, was underestimated by 8 times. And it's very easy to understand that being a real thing. The Delta wave back in 2021 hit India very hard. So yes, the death toll just in 2020 alone was underestimated, and as we all know, this pandemic was unbelievable, and in some places, it really, really hit hard. It hit hard here in the United States. I bet our number is likely an undercount as well. Alrighty, moving on to this. Oftentimes, there is some confusion out there. There's various different studies that come out. There's a lot of different things that are said about long COVID. But there is something that needs to be said to set the record straight, and something that you need to understand. Long COVID, it's a real risk to you. Yes, there are studies that say, well, the risk is dropping. However, with each infection, it still remains true that with every infection, your chance of getting long COVID does increase. So if we're going to allow this virus to continue to spread, which unfortunately has become reality, we need to understand this one thing. Each time you catch COVID, your risk of long COVID is higher. And this is coming from the CDC and the IDSA. I think IDSA stands for Infectious Disease Society of America. Someone correct me if I'm wrong about that. But anywho, I want you to hear this. Plain language summary. It is challenging to study long COVID and repeat infections, especially since repeat infections were not common before Omicron became the dominant COVID strain in late December 2021. However, research shows that repeat infections increase the risk of long COVID and could increase the severity of some long COVID symptoms in older adults. This is true even if they were fully vaccinated. Research suggests that some people with long COVID might also have reduced levels of antibody after COVID-19 compared to people without long COVID, which might increase their risk of reinfection. So again, with each and every infection you have, your risk of long COVID does go upward. And if you already have long COVID, well, a new infection on top of that could make your symptoms even worse. It's not a good thing. Try and avoid COVID as much as possible. Masking does work. There are several studies that show that masking does work. Alrighty, moving on now to a channel announcement, just a news note about the channel. I did give an update today to the About section of our channel. Now, we're not going to read the whole update, but there is something that you should take note of. And a lot of channels do this. We never did this. What's time is time. I think it's going to be good for you. I think it's going to be good for when you know when I'm doing my update. I think it's going to be good for me to give myself some sort of a schedule. I'm tired of this, one day the update's at this time, one day it's at the other time. Oh, I'm going to be running late today. I'm going to try and keep this organized now, where we actually have a set time each day where the daily pandemic update's going to come out. It's going to work for all of us. So Mondays through Fridays, you can look for the daily pandemic update between 3 and 5 p.m. Eastern Standard Time. That's here in the United States. And on weekends, my goal is between 12 and 2 p.m. Eastern Standard Time. Now, there may be some cases here and there where there's noise interference outside, or something has me delayed, or something comes up. If for whatever reason there is a change in the time of the pandemic update for a day, I will make a post on X saying I am early or delayed. And as you know, my X account is COVID Data Report. So just go to x.com/COVID Data Report and you will find me on there. I think this is going to be a good thing. We'll see if I can follow through with this. I'm going to try really hard, and it's going to keep me more organized, and it'll allow for you to know when to expect the update each and every day. Alrighty, moving on now. Today's National Allergy Map. Pollen levels. Hey, things continue to improve in the pollen department. 39% of the country is in low to medium status. So you can see here, yes, there's a lot of yellow, but there's also a lot of green as well, which means levels are dropping at this time, which that, my friends, is a good thing. You'll be able to breathe a little bit better pollen-wise, but when we come over here to what's going on with the air qualities, yeah, we do have some problems in this department. Yeah, take a look at this. Whoa, a lot of red, a lot of orange, and I'm concerned. Should the winds shift from northwest to southeast, a lot of other places across the country are going to tap into some of this bad air quality, which really is a problem thanks to wildfires up in the Pacific Northwest, the northern Rocky Mountains, even the northern plains, and up into Canada. You're seeing a lot of purples, reds, oranges. Please, if you have to go out in that area, once again, consider wearing a mask. Make sure you have your air purifiers running. It is really dangerous for anyone who has immunocompromised lungs, asthma, COPD, anyone who has breathing difficulty. Please limit your time outdoors in these areas. It's really dangerous. And even people who don't have breathing issues. If you're outside long enough under those type of air qualities, it's as if you're smoking cigarettes. So, yeah, it's not a good thing. Avoid going outside in those areas. I know you don't like to be told what to do, but in this case, it's for your own health and safety. You'll thank me later, and your lungs will thank you for it too. Heat-related illnesses, they're still a problem across the United States. I don't think we're going to see as big of an increase this week. There's a little bit of a lull in the heat right now, but there are forecasts from the Climate Prediction Center stating August looks to be relatively hot for a large portion of the country. So we'll have to keep our eyes on that. Want to learn more about climate and weather? I have another place where I do that. It is Climate Data Report. I'm going to be tweeting over there later today on some flooding threats that could be a problem across some portions of the United States. So again, that's Climate Data Report. Back to health. Philadelphia yesterday, 788 EMS incidents were reported. That, my friends, is a good thing. Finally, below 800 for one day. Hopefully we'll be able to do it again today. It has been a tremendously busy stretch in Philadelphia. Let's see if we can do a live look in on Montgomery County. We can. This was not working earlier. And 14 active incidents right now, EMS incidents. We can see here respiratory emergency, syncopal episode, abdominal pains, head injury, cardiac emergency, dizziness, whole bunch of things going on. Chester County does have some calls as well. Respiratory difficulty, seizures, falls, unresponsive person, falls and lift assist. All right, moving on now. Just one more thing. Then we're going to get to the wastewater update, which you have been waiting for. National positivity trend 39.2% at Walgreens this week for COVID. That's down by 0.4%. This will update again tomorrow. And I hope when we see tomorrow's update, I'm hoping for two things. One, positivity rate continues to drop. Two, number of tests continues to go up. That would be a very good thing. Alrighty, drum roll please. It's that time. It's a Sunday. It's time we take a look at wastewater. And I'll make sure I'm very detailed when I explain what the colors mean on this map. If you're new to my channel, like I said, wastewater basically is a sample of what's going on at your local wastewater treatment facility. Now, not every wastewater treatment facility tests for viruses in the United States, but quite a few of them do. This is the CDC page for COVID-1, and I can tell you on the national level, the current activity level for COVID-19 is listed as high. You can see that right here. It is very high right now, and the COVID level in wastewater, and only in wastewater, is now higher than it was last summer, which is very interesting to note. And again, that is only in wastewater. We're not talking about hospitalizations or anything else. And it has also happened earlier than last summer, and we have not even peaked yet, which will probably likely peak earlier than last summer. But again, we have already passed last summer's wave when it comes to wastewater, meaning cases, whether you're testing or not, are likely higher than last summer. All right, on this map, you see several different colors. You see gray colors, white, blue, dark blue, orange. White means new sites. Now, it's not always a new site. Sometimes it's a site that hasn't updated in a while. Gray means it's not updating at this time. As for white sites, there are 71 of them. Dark blue, really low levels of COVID. 0 to 19% COVID increase detected. And we can see here that's 87 sites. Slightly lighter shade of blue is 248. That's 20 to 39% COVID detected. 40 to 59% is the really light shade of blue. That's 352 sites. Orange, 60 to 79% COVID detected. That's 310 sites. And red, which is really high. There's a lot of orange and red sites. There's 160 red sites. That's 80 to 100% COVID detected. And we do note, despite there being gray, there's quite a few orange and red sites in the southeast, North Carolina. Orange and red sites, they're starting to show up in the Northeast as well. I think that's going to increase even more in the coming weeks. The Northeast is nowhere near a peak yet because they started pretty late. And out west, which is close to a peak now, is seeing a ton of orange and red sites, which is not a good thing whatsoever. And let's take a look at a couple of these sites. We can go up to the Northeast. What's going on up here in New London, Connecticut? And that is a beach area. I mean, that's along that I-95 corridor where a lot of people go to the beach in the summertime. 41,000 population, but does not include the people that just randomly come along in the summertime. And we can see here, look at the wastewater level. It is really going up. Let's take a look at Long Island, Suffolk County. Yeah, that is really rising at this time. That's getting close to be going red pretty soon. Montgomery County, Pennsylvania is seeing an increase at this time. And here's another Montgomery County, Pennsylvania. Did look like it stopped rising for a little bit. Now it's going right back up once again. Now there's another way we can take a look at wastewater. And we can also take a look at the averages in each state when you take up all the wastewater sites. So let's go to Texas, for example. 19 wastewater sites. Average that out. Well, all of them averaged together equals very high levels of COVID. And you can see there's dark blue sites. New Mexico, 8 sites reported. Very high levels. Utah, Nevada, Washington, Oregon, Wyoming, California. The majority of the West Coast is at very high levels. Arizona and Montana at this time are in high levels. Florida is very high. The levels in Florida have been just skyrocketing, and you'll see something in a moment. Some of their highest levels ever in the Orlando metro area, which is not good. Connecticut, very high for wastewater for you with 5 sites reporting. New Hampshire, very high levels. Moderate levels now in Pennsylvania. Wisconsin, moderate levels, and Michigan, moderate levels as well, and Missouri is at high levels at this time. Now, we can look at wastewater another way. We can use wastewater scan, and on wastewater scan, we can take a look at various different sites, and we can see what the levels are for several different viruses. Let's go region by region first, starting off with the nationwide level. We can see COVID overall has been rising. You see there was a little wonky straight up movement at the end. Don't worry about that. It will get corrected for COVID. RSV at this time is relatively low. Influenza A is low. Influenza B is low. HMPV is low. Norovirus is medium. Again, wonky movement. Don't worry about them. They do get corrected. And now moving on to the Midwest region. And in the Midwest, we can see high levels for COVID. It's been rising pretty moderate to steadily at this time. RSV is low. Influenza A is low, influenza B is low, HMPV is low, and norovirus is listed at medium at this time. In the Northeast, taking a look at that, we can see here the Northeast is relatively high at this time, and COVID's been starting to rise faster now on the most recent update dash correction. RSV is low, influenza A, influenza B, HMPV, all low. Norovirus is coming up as high at this time. Taking a look in the South. South is not doing good at all. Take a look here. Yes, you may think, oh, maybe this is a wonky movement. No, that's multiple updates for COVID. The South is really running high. Yeah, it may get corrected a little bit, but the South is not doing good at all for COVID right now. RSV is relatively low. Influenza A, influenza B, HMPV, all low at this time. Norovirus is coming in at medium. On the West Coast, taking a look here, we can see here wonky movement with the COVID chart. So we'll just disregard that. But overall, it is starting to level off a little bit. And again, the West Coast may be about to peak for their summer COVID wave. RSV is relatively low at this time. Influenza A was low. A little bit of a rise at this time. We'll have to keep our eyes on that with influenza A, especially in Colorado. Influenza B is low at this time. HMPV, not much of an issue. Norovirus is high. Wonky movement. It's probably really just moderate to high at this time. I do want to show you something in Colorado. Let's go down to the southern wastewater site in South Parker, Colorado. No, we want South Parker, Colorado here. Let's see if we can actually get it. There's North Park, Colorado. Here's South Parker, Colorado. And I want to show you here. Now you can see the COVID levels have made some very wonky movements. But something I do want you to take note of. Take a look at influenza A. It is actually starting to rise there. Something we need to keep our eyes on because we know Colorado has been having H5N1 issues as of lately in both farm workers and the animals at those farms as well. So that's something we will have to keep our eyes on. Now let's move over to Missouri and see what's going on there. But in order to do that, we have to go back to the CDC page in order to do this. Let's take a look at St. Louis area, since we really couldn't look at their emergency department visits yesterday. St. Louis and St. Charles area. 174,000 population and rising at this time. St. Louis again, still rising. And taking a look at Jefferson, St. Louis, red and rising. So not good in St. Louis at this time. Now going down to Florida once again. We looked at Florida yesterday. We're going to look at Orlando, Florida again today. Northwest Orange County. Take a look at this. Very high levels of COVID at this time. And if we were to zoom this chart out, let's zoom it out as far as we can see here. Now, this particular site is not at the highest levels ever, not like what we saw down near Disney yesterday, but take a look at this. It's getting up there. It's not far off from records. Will it pass the record? Hard to say because your peak could be within a few weeks, but it is continuing to rise. Now taking a look at two wastewater sites in Chicago. Stickney South. This is, wow, 1.1 million population. Your wastewater is rising, and if we go to the North Treatment Plant, yep, you are rising as well. So Chicago area, I'm not going to go through every wastewater site, but Chicago area is rising at this time. And when we go out to the West Coast, now I just want to do a couple wastewater sites there, then we will end this for today. Go out to California. Let's go down closer to the Bay Area if we can. You can see here Santa Clara. A lot of red still. You get the idea. Take a look at this. The wastewater levels continue to rise. Then if we go up to Oregon, you can see wastewater Douglas. Look at this. 30,000 population. You are in the red at this time. Continuing our way to the north. And you can see here, yes, things are just rapidly going up in Oregon at this time. And if we take a look at the Seattle area, we can see Seattle is continuing to rise as well. Pierce, King, it looked like maybe it was going to peak. Now it's rising once again, so not good to see, but eventually, I think the West Coast, within a couple of weeks, you're going to peak and really start to see your levels dropping. Alrighty, folks, that does it for the Sunday edition of the Pandemic Update. We'll have more wastewater sites throughout the week. I know, we didn't get to every state. How can you? I mean, we would be here for an hour, maybe even longer if we went through every single wastewater site. If you enjoyed this update, give it a thumbs up. Want to see more content like this? Subscribe to my channel down below. Hit that notification bell. Share these videos with anyone you know. And of course, leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic Sunday afternoon. And thanks for watching.